from
What is this one?
withdrawing from the World Health Organization, sir.
Ooh, that's a big one.
United States President Donald Trump signed an executive order to withdraw from the World Health Organization on his very first day in office. In this video, let's understand why did Trump walk out of the WHO, how much of the agency's funding came from the US, and what will be the implications on the functioning and, most importantly, the funding of the WHO. Let's begin. The WHO is a United Nations body working on global health. It works with countries to strengthen their primary health care. Its guidelines help prepare government policies, and it helps organize programs to tackle specific diseases. The executive order signed by Trump said the reasons for withdrawing were WHO's number 1, mishandling of the COVID-19 pandemic, number 2, failure to adopt urgently needed reforms, number 3, inability to demonstrate independence from inappropriate political influence of WHO member states, and number 4, for continued demand of unfairly onerous payments from the United States.
China with 1.4 billion people. We have 350. We have, nobody knows what we have because so many people came in illegally. But let's say we have 325. They had 1.4 billion. They were paying 39 million. We were paying 500 million. It seemed a little unfair to me. China pays 39 million and we pay 500 million. And China's a bigger country.
When Trump was in office during his first term, he was critical of the WHO for being too China-centric in its tackling of the COVID-19 pandemic. He accused the WHO of being biased towards China in how it issued guidance during the outbreak. The move does not come as a surprise, considering Trump had threatened to withdraw in his last term too. He officially notified the UN General Secretary of the decision in 2020. Nonetheless, health experts are concerned about the cut in funding and expertise that the WHO may experience in the coming years. So what does the executive order say? Trump's executive order highlights 4 key things that will happen as the US exits from the Global Health Organization. Any transfer of US funds and resources to the WHO will be paused. That's number 1. Number 2, all US government personnel or contractors working in any capacity with the WHO will be recalled. Number 3, the United States will identify credible and transparent United States and international partners to assume necessary activities which were previously undertaken by the WHO. And 4th, and most importantly, the United States will cease negotiations towards the pandemic treaty the WHO is working on. The accord aims to better prepare countries to respond to pandemics, create a framework for global cooperation if a pandemic happens, and develop mechanisms for equitably sharing medical countermeasures such as drugs and vaccines. So the big question, what will be the financial implication? Withdrawal of the United States is likely to have a huge financial impact on the WHO, with the agency receiving around a fifth of its funds from the country. Now, this is one of the points of contention for President Donald Trump that drives us to the big question, where does WHO's funding come from? Now, there are 2 ways: contributions from all its member countries and the voluntary contributions raised from various countries and organizations. Over the years, the assessed contributions have remained stagnant and now cover less than 20% of the organization's budget. Now, let's look at this chart and understand. In assessed contributions, the United States is the biggest payer, accounting for 22.5% of the contributions, followed by China at 15%. Of the total $578 million assessed contributions, the US pays approximately $138 million and China $87.6 million. Now, under voluntary contributions, while the US is still the biggest donor, accounting for around 13%, which is $356.3 million of the total contributions, in 2023, China accounted for only about 0.14% of the total contributions, which comes to $3.9 million. Now, the second biggest voluntary contributor was the Bill and Melinda Gates Foundation. The uncertainty owing to the US elections did result in WHO receiving more voluntary contributions last year. In the 2024 funding round that ended in November, Australia, Indonesia, and Spain pledged $1.7 billion, and this led to WHO getting 53% of the $7.1 billion it needs for program implementation between 2025 and 28. This is up from 17% it had secured for its previous 4-year period in 2020. Now, how did the WHO react to Trump's move? In a statement, it said WHO, the World Health Organization, regrets the announcement that the US intends to withdraw from the organization. WHO plays a crucial role in protecting the health and security of the world's people, including Americans. On the matter of transparency, the WHO statement added, quote unquote, with the participation of the United States and other member states, WHO has over the past 7 years implemented the largest set of reforms in its history to transform our accountability, cost effectiveness, and impact in countries. So, will India be impacted? With WHO losing out on a significant proportion of its funding, its work across countries, including India, is likely to be affected. The WHO participates in and supports several health programs of the Indian government, such as its work on neglected tropical diseases, HIV, malaria and tuberculosis, antimicrobial resistance, among others. Importantly, it plays a significant role in the country's immunization program, with WHO teams even monitoring vaccine coverage. In addition, the loss of expertise from the United States would also impact WHO's role of providing guidance. This will also sever the collaboration between the WHO and the US Centers for Disease Control and Prevention, which is key to international surveillance and response to health threats. So, can member states withdraw from the WHO so easily? Well, there is no provision for withdrawing in WHO's constitution, but the US Congress, however, at the time of joining the organization in 1948, had laid down a condition that said the country could withdraw after giving a 1-year notice and meeting the financial obligations of the current year. That's all for today. For more such explainers, don't forget to like, share and subscribe to our channel, The Indian Express. Thank you so much for watching.